This is Dr. Brad Stelflug. We're at the Hill-Rom Simulation Center at Marian University, where we train the next generation of CRNAs. One of the very few places in the country that actually have this high simulation practice. Here is where we control our high-fidelity HFPS Sim man. Basically, anything that the students do with this patient, the patient is going to respond as a human being would, hemodynamically, respiratory-wise, with all medications and different procedures that they do on this patient. And this is just one of our simulation centers that we have at Marian University. As students come in here the first year, they're going to be practicing intubation skills on our mannequins, just like you would with ACLS. But then as you progress, we are going to add different task trainers, such as spinals and epidurals on the backs. We train you to put in A lines and central lines. So you're going to get lots of hands-on training with the ultrasound, with needle manipulation. And what that culminates to is, before you go into the clinical site, I'm going to have you get your routine down for putting a patient to sleep and waking them up for general anesthetic. So we have one of the anesthesia machines that's used in the clinical sites. Again, the monitors are going to show everything that we do to the patient. We take our drugs and we just scan the drug. The computer now knows that this is propofol, and then when I inject it into the IV, if I give 5 cc's, the computer is going to register that it's 5 cc's of propofol that I gave that patient. And then we go ahead and we intubate this patient. We also can do cricothyrotomies. We can do needle decompressions on this patient. Patient has pulses, basically about as realistic as we can get it. I'm not going to teach you just some of the skills. I'm going to teach you independence and to be able to do everything. What you choose to do afterwards in your career, I 100% support, and just basically want you to be happy doing the greatest job on the planet, which is nurse anesthesia.